So let's everybody get out. We're gonna go to the front, and then we'll start from the front, and then we'll come back.
Follow Xengxai.
All right, Lolo, hello. We get a break, we can come in here and eat here. There's microwave, there's the fridge, coffee maker, water, and so I'm just gonna let you know that my job is I'm a medical doctor. Okay, so what is a medical doctor? A medical doctor is someone who, when you're sick, you go and see, right? And they will help figure out what's wrong with you, what kind of illness you have, and they can help you by either giving you medication or tell you what to do so you can feel better. So that's just a basic idea of what a medical doctor does, okay? And so,
Chill, you like it? You're going to see a real doctor job too.
so this is the entrance for patients to come in, okay? So you guys park out there earlier. This is where people walk in. When people walk in, they check in the front here. You check in the front, and then the people will put your name or the patient's name on the computer, and that will send a signal to us over there in the back that, oh, this patient here, right? And so our medical assistant will, they'll have the patient sit there. The medical assistant will call the patient, and then take the patient to get their vitals, which is blood pressure, check their weight, their height, and all that, right? Which we all have been to the doctor before, right? Who hasn't been to the doctor before? So yeah, we all went to the doctor before. All right, good. All right, so we're gonna go this way. So I will walk you guys through as a patient, and I'll talk to you about what I do too as the patient comes in. All right, come on.
Go Anna.
They do the vitals right here. They use this for temperature, okay? Temperature, and then we also have the room. So these are all. You see how the rooms are numbered 1, 2, 3, all the way to 9. There's 9 different rooms for a patient to sit in. And so once the medical assistant room the patient, then they will put in the system where they write it on the paper, and they bring it to us as a doctor, and that's when we know that the patient is ready to be seen. Okay, and so each room is equipped with all the equipment as a doctor to check the patient. I'll take you guys to the bigger room, which we call the procedure room, okay? So come in. Go inside here, go. Come on, okay, so this is one of the bigger room that we have in the clinic, and we call this the procedure room. So if anybody needs a procedure done, then we usually take the patient here. So the type of procedure that we do is knee injection, right? Let's say people have knee pain for a long time and it's been bothering them, then we use medication and we put in the needle and we put it into the knee joint or shoulder joint or back pain, right? And we also do, like, some people has their toenail that grow inside the skin and it's very painful, and so we take them here, we put in numbing medication, and then we take the whole nail out. It's called toenail removal, right? So we do stuff like that here. If people have skin tag, let's say if you have skin tag, like something is growing out from your neck, your armpit, stuff like that, we also cut those out too. So stuff like that. We do it all in this room. And in here we also have the EKG machine. This one checks for electricity in your heart, right? It checks to see how your heart is beating with the electricity, all right? And then we also have like a bunch of other stuff too, but some of the more important things that we also do is, oh, blood pressure is not working. We also use these to look inside the eyes and the ears and nose and throat, right? So who wants to be my patient today?
Raise your hand.
A volunteer.
I need a volunteer. All right, have a seat, Kennedy. All right, so let's say if Kennedy is one of my patients, Kennedy comes in and he says, oh, I'm having this ear pain. As a doctor, I have no idea what's going on too, right? So what should I do first? I should ask question, right? Like, where is it? Is it on the left side or on the right side, right? And then he say, oh, on the left side. How do you feel? Like, is it painful when you press on your ear like this? Because if it's painful when you press like this, then it's on the outside. But if you press like this and there's no pain, then it must be on the inside, right? So now, as a doctor, I'm gonna have to take a look, right? So I'll take a look and to see if there's anything abnormal, okay? So it looks good. But what I wanna do is I wanna look at the normal side first, so I can compare to the one that's painful. Because if I look at the painful side and something weird is going on, but I don't even know how his other side, the normal side, looks like, right? So usually you start with the normal side and then go to the side that is painful. So that's for the ear. But there's a lot of other things that we also check for. We also redo the blood pressure cuff too, okay? Like the blood pressure. Sometimes when patients come in, they have the blood pressure is very high when the medical assistant put it on them. We let them sit for like 10 minutes and then I usually come in, I usually do the blood pressure myself just to check it, okay? Another thing is we have this life-saving tool right here that listens to people's heart and lungs. This is called a stethoscope. Who knows how to use a stethoscope? Nobody? All right, so that's great. So this one, you put it in your ear, and then basically this is called the diaphragm. There's two sides to it. This side, here's noise to more on the left side, okay? So I hear his heart is beating regular and it's beating normal, okay? Normal rate, which means at a good pace, okay? So,
See if anyone wants to volunteer as a doctor.
Yeah, so I have two stethoscopes. It's because I want you guys to be able to listen to someone's heart, okay? So I'm gonna pass this around. You can come in and we can just all listen to Kennedy because it sounds really good. So you can come and I'll show you how to do that. You hear boom, 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 boom.
Is it that small baby noise?
Yeah, it's just small, very small noise. Okay, good job. All right, here. Okay, so try to listen for the sound that goes boom, boom,
Now you
boom,
hear something?
boom.
Do you
Okay?
hear something?
Yeah, so that's the heart. That's the heart. Pass it on to your sister, nah?
Go on, you hear something? Yeah. Do you do it right? The earpiece? Yeah? Oh, okay.
Yeah, okay. All right. Okay, Nilo. No. This way. Yeah. See, newborn, like let's say people just the baby was just born. We can go see. We can see them, and we see all the way to like old age, and so we don't limit. There's no limit. But I mean, if once you are done with training and you come out and you practice, you can choose to see a certain type of patient, like a certain age. It's up to you. But for us, we are trained to work with all ages. So all the kids, all the adult, all the old people, we see them all. We see OB patient too, like pregnant women, they come in here, we see them too. But when they are going to deliver, we have to refer them to an OB who can deliver at the hospital, because we don't deliver there. But for training purposes, we deliver. Like we go to the hospital and we actually help deliver baby for patient. Okay. Yeah. For all the medical assistants. So the medical assistants are the one that help us as a doctor, and they usually ask some questions from the patient. They take them in and do their vitals right there, and then this is their workstation. Once they room when we get a patient, we usually know our schedule. We usually see all our patients' name already, and we know who we are going to see. All right. Let me see if I can open up the computer, and I'll show you guys a sample of my my schedule, because we can see the patient ahead of time. So when we know that, oh, this patient is checking in, you can already look at their history, what they're here for, in the past, what kind of illness they have. So you already have an idea of what you're gonna do with that patient during this visit. So most of the patient that we already know, then we already see them before, then we already know the reason why they're here today. And so we can think of a plan already, right? Think of a plan of what to do with the patient. And so sometimes when you go see your doctor, it takes a long time to check in, get vitals, all that, wait for a long time, and then the doctor just come and talk to you for like 5 to 10 minutes, and they're already like done. It's because they did a lot of work on the computer, checking your files already. Okay. Give them fluoride supplementation, like the fluoride is to prevent cavity, right? And so sometimes we might not remember. So all of these are like reminders, right? And then a lot of the things like scheduling, everything else is all around. And so there's a lot of things to know and to remember as a doctor. You will not ever remember everything, and so we still look at we still use our phone, we still use the computer to search up stuff that we don't remember, so it's normal for that. So this is my schedule for tomorrow. You guys see, I have 2, 4, 6, 8, 10 patients scheduled in the morning. I have 10 patients that will be coming in, and I'll be seeing them from 8 o'clock to 12 at noon. And so each of them has they have like a reason to come and visit me. So I already know, oh, this patient right here looks like they're following up because of diabetes, right? And so when I click and I go into her chart, then I already know, okay, this is let's say a 60-year-old patient, and she's here for diabetes. I look at her labs, okay? I look at her lab result, the blood work that we draw. In the past, she already draw some blood work. So now I go and look at her diabetes. So we do that, we look at that. And then when the patient's ready to be seen in the room, I go in and I just tell them, okay, how are you doing? I examine them, I look at them, I make sure they're doing okay. And then I talk to them about their medication and what we can change to make them better, or should we just keep it the same, right? So those are the stuff that we do as a doctor. All right, so we also have an X-ray room too, in patient, right? I say, oh, you know what? Let's check how your kidney is doing. Let's see how, your diabetes level is, right? How about your cholesterol? Then I put in the order in the computer, say we do check this for the patient. The patient comes in here, and there's a worker here that can draw. Then they send it into this room, and he takes care of them. He does all his stuff with them, and then once the X-ray is ready, he'll let us know, and then we come in and we just take a look at the X-ray. Okay, and so we do have this, and they come in every day. So any patient that come in with, let's say, if they had a fall, right? Let's say if they trip and fall, and now they can't walk, or they can walk, but it's very painful, right? Now, what you want to know as a doctor is that, okay, well, it's very painful. Is there something broken, right? So when we send it to X-ray, we mainly look at the bones. Okay, X-ray is mainly to look at the bone. And so if we X-ray the feet and there's no broken bones, then that's good. It's gonna heal. The body's gonna heal, but it's gonna take some time, and there's going to be pain. So as a doctor, I'm going to give them some medication for pain to help them relieve the pain, so they can walk and do their stuff at home. They find us the paperwork that we need. So let's say if a patient come in and they say, oh, I just went to see an urgent care because I was having some stomach pain, and then the patient doesn't bring us any paperwork. Now, as a doctor, there's a lot of things that I already have to do, so I can't go and chase or look for the paperwork, right? So we have a team member here that go and does all that for us. And so they'll go and find the file, and they'll bring it to me in the room. For all the front desk people, and they sit here, they meet and greet the patient, and do all the registration process, fill out paperwork and all that in front. Right over there, and that side of the building is the dental side, where the dentist and the team, they're over there, and they just focus on just doing the teeth. Okay. And so that's pretty much it for the tour. We're gonna go ahead and go back to the room, and if you guys have any more questions, we can talk more in the room.